Welcome to Akhand Vidyashram, the first institute of impeccable wisdom, the walking, talking encyclopedia. Examination, the arterial human blood pressure. My dharma, the impeccable wisdom, the wisdom of every perfect object of the universe. My greatest discovery, Divyank, the divine design of nature with which the perfect objects are designed and created. Divyank is the reward of 60 years of integrated education. Impeccable wisdom is enlightening. Akhand Vidya wisdom is empowering. Let's start with this particular project about understanding how to take blood pressure, arterial blood pressure completely and clearly. Let's understand what exactly is heart, what are the four chambers, and what functions do they have. From that angle, this particular picture shows when blood and oxygen is used by 100 trillion cells at cellular level called systemic circulation or body tissue or circulatory respiration. Carbon dioxide is produced. That carbon dioxide through the capillaries is carried through superior inferior vena cava into the right atrium of the heart, then through tricuspid valve goes to right ventricle, then from pulmonary semilunar valve, it goes to pulmonary trunk to the lungs. And in the lungs, oxygenation is taken place. Carbon dioxide is thrown out, 61.803%, and oxygen is taken, keeping Devyank in mind. And then blood, instead of blue, which is deoxygenated, becomes red. That means it's oxygenated from lungs, alveolar, through the pulmonary veins to left atrium, then through bicuspid valve or mitral valve to the left ventricles, then semi-aortic lunar valve to aorta and to the general circulation. This is the circulation with which the blood flows to make sure we are perfectly normal. As I have said, blood pressure is the seat of life. It has to be perfectly healthy 24/7. From that angle, this particular project becomes very important. But in this particular picture, as you can see the heart in the middle, you see aorta red arch. The one on the right side has got one coronary reflex which gets divided into two, brachial and coronary on one side, whereas the left side has got both coronary and brachial separately. So as a result, checking blood pressure in the left arm is ideal, not in the right arm. That is something which I want everybody to understand. Please take blood only in the left hand, not in the right, because blood is directly coming from aorta into the capillaries to the brachial as well as to other arteries directly from aorta from the heart. Interference is not there. As a result, it is perfect blood pressure, what we expect to do. That is something which I want everybody to understand. Cardiac cycle, that means the number of events per minute in the heart have been calculated to be around 70, 72, and each duration 0.8. Atrial has got 1:7 ratio. It's more like atrium, which collects the blood from the rest of the body into the atrium, then it goes to ventricles. Whereas ventricles are like a pumping station. So systolic blood pressure is 0.3 or 0.8, which is 38.1966%, and diastolic is 0.5 out of 0.8, that means 61.8034%. Once this ratio is maintained of systolic and diastolic, both in atrium ventricle perfectly, and you can maintain your blood pressure 120, 170 throughout. And that is the ideal situation which I want. And how to achieve that is something which I have already spoken. Keep everything which is normal, physiologically perfect, as good as sattvic, and that's it. So from that angle, this cardiac cycle by and large gives you the picture. This is how the heart has been designed. This is how the heart functions. This is how the heart has to be handled fully. So understanding blood pressure is one. Arterial blood pressure is very important. because that is what is going to give us. Systolic, the atrial is not necessary to study, but ventricular has to be studied, and that is what we are trying to do. Now, blood pressure, let's understand what it means. The pressure exerted by the free flowing stream of blood on the lateral walls of the blood vessel is called blood pressure. There are four different types of blood pressures which we need to understand and comprehend in life. Systolic blood pressure is the highest maximum blood pressure during cardiac cycle. The perfect value is 120 mm of mercury. Diastolic blood pressure is the minimum blood pressure during a cardiac cycle. The perfect value is 74 mm of mercury. Pulse pressure is the difference between the systolic and diastolic blood pressure, and the perfect value is 46 millimeter. What is very important is mean arterial blood pressure, which is extremely vital. This is a perfusion pressure of all the vital organs. It is uniform for the vital organs. The perfect value is 93 millimeter of mercury. If you have a systolic blood pressure of 20/74, you are going to get mean arterial blood pressure 74. But as I have most of the medical books, they say how to calculate mean arterial blood pressure, diastolic blood pressure plus 1/3 of the pulse pressure, which in my opinion is defective because it does not follow the cardiac cycle as designed by nature. The perfect integrated value would be diastolic blood pressure plus 38.196% of pulse pressure, which is 93. This is what we have to achieve in this particular evaluation of arterial blood pressure. So now I think one by one we have brought it close to what we are going to achieve. And this again a reflection of the first picture shows how blood pressure flow is having on the arterial wall and how the left arm has been used to choose the blood pressure directly, and what is systolic blood pressure, what is diastolic blood pressure, what is pulse pressure, what is mean arterial blood pressure has been shown clearly, and graphically also we have produced from aorta to the arteries to arterioles, capillaries, veins and vena cava, how it systematically goes down. What is the oxygenated blood, what is deoxygenated blood, you can see in this picture very clearly. Having understood the value 120/74 should be the ideal, 93 to be mean arterial blood pressure, and it has to be seen in the left arm. And this, if this picture is very clear, now let's move on to the next stage to understand how do we go about finding the perfect value without any problem. At this juncture, before going to that, as I've told you, end diastolic volume, the amount of blood in the heart ventricles after full relaxation should be 120 ml. Stroke volume of amount of blood pumped by each ventricular during ventricular contraction or systole should be 74. And stroke volume, the amount of blood in the ventricles after the contraction of the ventricle should be 46. Ejection fraction should be 61.8034%. Cardiac output should be around 5 liters. And cardiac index should be like 3 liters per square meter. If these 6 values are maintained 24/7 and blood pressure is maintained, heart is perfectly fine, 120/74, 93, 72 heart rate, ejection fraction of that, you are perfectly healthy, wealthy, wise and happy. You should have no problem whatsoever. As long as all your perfect anatomy, perfect physiology, perfect biochemistry, perfect psychology is maintained, thou shalt remain physically, emotionally, mentally, intellectually, and intuitively in tune with universal consciousness and do the kind of wonders which human beings are designed to do. From that angle, now let's go to the next stage. Now, examination of blood pressure is the same emphasis which I would like to now describe one by one systematically. Please listen carefully. Direct method is used in animals. A catheter is used to enter the arteries to examine the arterial blood pressure of the animals. This is done in animals in experimental laboratory conditions, but this is not what we are going to do in human form. Let's leave it to the researchers, let them do their bit in their own way. As a matter of fact, all the research is always done on these aspects. Then second is indirect method using sphygmomanometer. That is a blood pressure apparatus you have seen, and how it has the different things which are taken place. A is a palpatory method. Palpation means you can feel the arterial radial pulse completely. To examine the arterial blood pressure with the help of palpation of the radial artery on the left or the right, I would prefer the left arm to be very clear. But ancient Indian sages who were experts in Ayurveda, they knew exactly to diagnose almost all the physical conditions of the body by checking the radial artery itself clearly. You can easily make out what is the condition of the arterial artery. As the blood flows into this, put three fingers there. You can make out the condition of the artery. Is it full? Is the volume full? Pressure full? Consistency continuous? And you can feel A to Z. If all the 5-6 different parameters with the fingers are palpatory method, you can feel the pulse 100% without any problem. You can easily say that the person is perfectly healthy, wealthy, wise, and happy. In my own case, ever since my childhood, ever since I started feeling my own radial pulse, I find even at this 73 plus, I have the same pulse which I had as a young person. That means volume is 5 liters, pressure is 120 by 74, pulsation is clear, is consistent, and there is no block. I can press the completely and there is no palpitation. There is no accumulation of anything, plaque or otherwise. Is as good as when I was in my 20s. That is something which I am very happy. All the process of Akhand Yoga, 10 processes, all the Ayurvedic concepts and ancient Indian wisdom have made me sure I should have no problem at all. From that angle, palpatory method is absolute bliss for anyone to do, and for that Ayurveda is the ideal system to tell you how you can diagnose A to Z of almost all the heart problems by pulsating, palpating only the radial artery in the left arm itself carefully. And that's what all systolic Ayurvedic sages were doing. Having understood the palpatory method to find out the arterial blood pressure, and it is only systolic you can find out, you cannot find the diastolic. That is also something which I want people to remember. Palpatory method is only for systolic, not diastolic. To understand diastolic blood pressure or manipulation completely, you need a stethoscope and sphygmomanometer. That's what is done by all the doctors in all the hospitals. These days, everyone, including Ayurveda, homeopathy, naturopathy, allopathy, everybody is using that system of sphygmomanometer, stethoscope to find the blood pressure. So auscultatory method is when you can auscultate the method completely. We are going to discuss little when we discussed about broadcast sounds which are produced during the process of examining this. But auscultatory is we are using both stethoscope and that. You can hear the sounds and you will know the highest sound which appears is the systolic blood pressure, and the one which disappears again is the diastolic blood pressure. From that angle, auscultatory will give you both systolic and diastolic. Palpatory give you only systolic. Oscillatory method is observing the oscillation of the mercury in the sphygmomanometer. Will give you an idea what could be the mercury oscillation of the sphygmomanometer by and large. So from that angle, I would still say this is something to be understood completely. Now I have a very unique question, which has been my specific question when I was a teacher or professor of physiology in Department of Physiology. To every student I was asked, can you examine the perfect systolic blood pressure and perfect diastolic blood pressure without the use of the stethoscope? You have the sphygmomanometer, but no stethoscope. Can you do it? And I'm categorically saying I did not find even single student to explain that to me completely. Nobody could answer my question. Then I had to explain to them, you can easily do by putting the calf muscles in the left arm of the subject you're going to test, and let the person become aware of the sensation in the left arm, and ask him to very carefully listen to the sound which is appearing from the left arm in his body as I'm going to pump in and pump out the air from the calf muscles. And when the sound comes and when sound disappears, very categorically tell me so that I can check with the oscillatory method to see this is systolic, this is diastolic. And I can tell you what we do, put that, increase the pressure by 20 millimeter of mercury, more than what we expect through palpatory method or auscultatory method, and then slowly start releasing. The stage will come when the person will be able to see the sound, feel the sound. Then slowly increases, then it disappears, becomes a murmur, and then comes to stop. The one when starts hearing is a systolic, the one when disappears is a diastolic. And as a result, you can get a good idea. That is something which I wanted to share in this particular thing. This is how it goes. From that angle, let me go to the basis of Krotkov's sounds. So while we are doing this test, we can listen to certain sounds which go on in the heart, and we can feel with stethoscope. Let's start one step by step. The first step, when the cuff of the sphygmomanometer around the arm is inflated above the systolic blood pressure by 20 mm more than what we have felt through palpatory method, the arterial blood pulse is fully blocked. They will not be able to feel the pulse at all, and it is 20 mm more than the systolic blood pressure. But that is what is the first sound to be observed. Having done that, then start slowly reducing the air from the calf muscles. As the air starts coming out, as the pressure is slowly reduced, arterial pulse starts appearing when we reach the systolic blood pressure level. And this is because the turbulence created by the flow of the blood in the arteries from a surface over where occlusion has taken place in the left arm. When that blood starts flowing, and that's called turbulence, and the blood flow till we reach is the diastolic blood pressure. This turbulence goes on. It appears as systolic blood pressure, then goes on till diastolic blood pressure, is one we are going to see. When we start examination in the whole process, a clear sound appears and becomes louder for first 5 to 10 millimeters of mercury. When we have started reading the pressure, sound will start appearing. It will be clear sound and become louder for first 5 to 10 millimeter. Second, the sound slowly and steadily becomes murmur or murmurish. It starts giving trufflish sounds, artificial sounds not used to that, for the next fall of 10 to 15 millimeter of mercury. Then next the sound becomes clearer and louder for another fall of 10 to 15 millimeters lower levels. So that's how it goes. Then suddenly the sound becomes muffler and muffler as slowly as we proceed further and further, and disappears slowly. Finally, the sound disappears fully. These are the bases of Krotkov's sounds. So what we have observed in this particular thing is, when we put the cuff and inflate the air into this 20 millimeter more than systolic blood pressure, there will not be sound at all. Whole thing is blocked. Then slowly start reducing. Then blood starts flowing. It created turbulence. Its sound, when it first appeared, is systolic. When it disappears, is the diastolic. And that these are different sounds which you hear from beginning to middle to the later to the end. And that is Krotkov's sounds, which we'll have to observe to show that we have absolutely no problem at all. At this particular juncture, let me also bring another element for the benefit of students who are very serious. There is something called auscultatory gap. Auscultatory gap is the one in patients suffering from very high blood pressure. When the blood pressure is more than 220 millimeter of mercury, systolic blood pressure, you put that, you might see sound. But then for some time you may not hear the sound at all. And you start hearing sound at a lower level. To avoid that particular problem, you should do a palpatory method to start with, not auscultatory alone. Palpatory first, then auscultatory, then a turbulence, and then see for yourself whether auscultatory gap is there or not there. If the gaspardary artery is this, that means the blood pressure is more than what you would have tested if you are not careful for that. So from that angle, that is also to be noted. And what are the different aspects should also be noted. But at this particular juncture, let me also bring it very clear. Don't go by one reading for the first time. Do it and observe at least 3 different stages in different situations before you diagnose a person with hypertension. But at the same time, I would like every doctor to keep the subject quite entertained. Let there not be something called physiological hypertension or doctor hypertension when you go to certain people, because you think like that. And that itself can increase it. That is again an issue which I want everybody to remember. So testing a blood pressure, remembering it for the rest of life, what I have explained A to Z, which is not found in the books, but I can assure you, if these steps are taken very carefully by all the medical student doctors, even they are now of late, patients themselves have become aware of taking blood pressure at the home. If they can understand this and implement in the home, I can assure you they'll have a much better understanding of flow of arterial blood pressure, systolic to diastolic to different phases, and over a period they would be able to get rid of the problem of hypertension once for all. And almost A to Z of different aspects of arterial blood pressure, systolic, diastolic, mean arterial blood pressure, and A to Z, I think I've covered quite a lot, and it should give a good idea, because we are talking of the issues which are normally not even spoken of. Concentration of autonomic nervous system is very important. Sympathetics should not come to the play. Vagus should remain, and as a result you can control the blood pressure quite normally. And we are going to talk more in the next video about the role of vagus nerve, how we can control flow of blood pressure, how can we, whatever may be, how it comes back to normal step by step, one by one, will be discussed in the next video. And this picture, I don't think we need to talk much about it. I think we have spoken quite a lot. We'll speak as and when there is a need for it. So at this juncture, let me say, it has been a pleasure speaking to you about the examination of the arterial blood pressures in a systematic ancient Indian system, or step by step, and be the master of evaluating blood pressure. So thank you very much once again. Thank you.